The vaccination of people in Kenya against coronavirus disease with the AstraZeneca vaccine began on 5th March. The plan is to vaccinate frontline healthcare workers, the security personnel, and then we move on to teachers and instructors. I'm happy that vaccines have been distributed to all the 9 regional vaccine stores and that the 47 counties can now collect their allocations. That is the reason Nairobi is actually starting vaccination. During this week, the vaccination is taking place at 47 public. By Friday, we expect that vaccinations will be taking place at about 47 posts throughout the country. All these posts for this week are government-owned health facilities. We are working with the county health authorities, including Nairobi, to enlist a further 432 facilities, both public and private, including faith-based run hospitals, to offer vaccination during this first phase that runs up to 30th June 2021. We are not going to allow people to jump the queue. We therefore request county authorities to ensure that this is adhered to. Secondly, vaccination posts. We have received reports that some facilities are assuming that the vaccines allocated to them are to be used only for their employees. In fact, we are informed that some health workers have been turned away from some posts because they are not employed there. The correct position is that once a vaccination post has been listed, it should offer vaccination services to any health worker who can identify himself or herself with his or her professional registration or job identity card. This vaccination post should cater for all health workers, whether they work in public or private facilities.
It is my pleasure to be here today for the official launching of COVID-19 vaccine. As you are all aware, His Excellency the President's Big Four agenda includes universal health care, and we are doing our level best to ensure that the health services within Nairobi County are improved to the level required. As we started 4 months ago, starting the hospitals, we have already commissioned or officially opened fully operational hospitals, 4 of them. This weekend, we'll be opening 2 more in Gatina and Gishagi. That will make a total of 6, and we'll continue opening 2 almost every week until we finish the 24. Part of the expansion of the hospitals will also include Mutwini Hospital, which we have just finished the normal authorization and procurement procedure. So soon we'll come to break ground for the new level 4 hospital to be built here in Mutwini. All these efforts are part of His Excellency effort to increase the healthcare in Kenya. And us in Nairobi County, we are doing our level best to ensure that we become the shining example as a county in expanding this program. As you all are aware, as from 7th March this year, Nairobi has reported a total of 48,358 confirmed positive cases of COVID-19, which accounts to 44% of all the cases reported in Kenya since COVID pandemic started on 13th of March 2020. A total of 681 deaths have been reported in Nairobi, out of the total of 18,661 deaths in Kenya. NMS has isolation facilities at Mama Lucy, Bagadi Hospital, and Kibera South Health Center. NMS, with support of National Multi-Agency COVID Command Center, has established a testing laboratory at Mama Lucy Hospital. As part of response, NMS has established an emergency operations center which coordinates the response activities. Members of the public can call for assistance 24/7 through a toll-free line, which numbers are 011 000 8608 or 011 000 8609. NMS has identified 16 facilities to offer vaccination services, and the staff are already trained. For this week, we will start with the following 6 centers: National Spinal Injury Hospital, Madare Hospital, Moi Air Base Hospital, Bagadi Hospital, Memorial Hospital, and Kenyatta University Medical Center, including here at Mutwidi, which is the official lounging center. The vaccination will be undertaken in 3 phases. We are currently implementing phase 1, where our target will be healthcare workers, community health volunteers, and facility support staff who are our frontline workers. Nairobi has been allocated 72,000 doses of vaccine for the vaccination centers within Nairobi. NMS is targeting to vaccinate healthcare workers, both, as the director has said, in public and private sector. This entails around 5,000 healthcare workers in public sector and 22,496 in private sector, an additional 7,300 community health volunteers. The second phase will target those with conditions like diabetes and hypertension, among others, while the third phase will target all other eligible patients. NMS will also continue to provide quality PPEs for all its staff.
Afraid, that may be cautious, particularly those who are in the healthcare sector. They may be panicking a little bit, but that is okay. It is okay because we are dealing with a pandemic whose body of knowledge is still very limited. More information keeps coming in, so every day we are learning more and more about it. Now add on to a vaccine equally new, and then bring in social media, gutter press, and then you have a cocktail of a lot of uncertainties. And therefore it is okay for the healthcare workers who may be a bit reluctant to come forward, because that is natural human reaction. Even the faith-based organizations that may still be reluctant, but that is because information has not been able to get to them. And I'm glad that you're here so that you can be able to pass this information to those who are still reluctant, that this vaccine is okay. You have seen, I am a frontliner. I would have been very happy to be vaccinated, but I'm not a healthcare worker. And therefore, in the next stage, certainly I'll be more than ready to come forward, to give confidence, to also give motivation to others who may have been infected as survivors, but are reluctant to come and be vaccinated.